Good afternoon. My name is Conrad Gruson, and I'm a practicing shoulder surgeon and professor of orthopedic surgery at Montefiore Medical Center in the Bronx. I've been a member of AOA since 2016, and even in that short period of time, it's obvious to recognize AOA's focus on leadership, mentorship, education, and clinical excellence. To that end, it gives me great pleasure to be able to recognize Dr. Burton Roy Moed as a 2023 AOA Pillar of the Orthopedic Profession. In my short academic career, I have encountered few other academic orthopedic surgeons like Roy, as he was affectionately known, who embodied all of the ideals of AOA, both through action as well as through words. I first met Roy when I was a first-year medical student at NYU. Purely by happenstance, I was standing next to his older daughter, Lisa, who is now my wife, during our white coat ceremony at NYU. And from that point on, he became the consummate mentor for my career. He helped me pick orthopedic surgeons that I should work with in order to maximize my chance of getting into an orthopedic residency. Roy's dedication to service was apparent very early in his life, even before he entered into an orthopedic residency at the St. Louis University School of Medicine. He served a stint in the U.S. Navy, and that required him to, as he put it, sit on a boat and act as a general doctor. And when he started his academic career in 1998, at whichever hospital he was on faculty, he always held a position of leadership, either as a vice chair at one hospital or chief of orthopedic trauma at another hospital. And his leadership skills were clearly recognized, and his ability to galvanize the people around him, his team, because in 2003, he ultimately was named chairperson and professor of orthopedic surgery at the St. Louis University School of Medicine, his alma mater. And in the 17 years he was at SLU, that program became nationally renowned, and its academic productivity increased to where it is today. And in 2013, he became the endowed chair, the Hans-Jörg Wyss Chair of Orthopedics. Many of the medical students, and certainly the countless orthopedic residents and trauma fellows that he's trained over the years, hold leadership positions in their respective fields, and I'm certain that they would thank Roy for helping guide their career. He has over 150 publications in the peer-reviewed literature. He's clearly had a passion for research because he knew that taking a simple idea, coming up with a research project to test that idea, and ultimately bringing your results into the peer-reviewed literature could advance the field. His numerous book chapters that he's written, these are seminal works that young or junior trauma attendings, any trainee that's looking to go into the field of pelvis and acetabular surgery holds near and dear. These are seminal works and must-haves and must-reads. He has served as a deputy editor for some of the major orthopedic journals, including the Clinical Orthopedics and Related Research, the Journal of Bone and Joint Surgery, and the Journal of Orthopedic Trauma. And his influence wasn't just confined to the national arena. He also held a position as a chairperson for the AO, for their International Grant Foundation. So certainly his skills were recognized not just here in the United States, but also worldwide. Following Roy's untimely passing in 2020, it did not take me very long to recognize the AOA Pillars program as the appropriate means for applauding his accomplishments and all that he has done for the field. He embodies the clinician scientist who puts patient care first, who generates clinical research to advance the field of orthopedics. He's a true selfless mentor in that he puts other people's careers ahead of his own and tries to advance you to get you to where you want to be. And he's a selfless leader in both the national and international arena. Perhaps most importantly was his ability to balance family life and his work life. And some of the things that I learned from him, I incorporate in my daily life as well. I'd be remiss if I didn't thank Mark Varus, who is a co-champion for this tribute. Without Mark's help, there's no way we could have gotten this done, and he was a near and dear friend of Roy's for many, many years. I want to thank also all the contributors to the pillar. And that list includes many lay people, includes many medical doctors. And from that list, you can see how Roy is able to touch people both within the field of medicine and outside of the field of medicine. In closing, Roy, I just want to say to you that we love you, we miss you, and we want to congratulate you for a career well done.
I'm Dr. Mark Veras. I'm the chair of orthopedics at Cedars-Sinai, one of the co-champions for the honor of pillar of the orthopedic profession for Dr. Roy Moed. Dr. Moed is certainly deserving of this honor, and I really thank all my colleagues who contributed to this effort in honoring this much-deserved credit for Dr. Moed. I met Dr. Moed in Toronto when I was a fellow, Dr. Marvin Tao's fellow at the University of Toronto. Dr. Moed had been Dr. Tao's fellow a few years earlier and was in town for a pelvic and acetabular course. I had an immediate affinity for Dr. Moed, and we became lifelong friends and colleagues from that point on. This isn't unusual. Anybody who met Roy professionally or personally had an immediate affinity for Roy. His very quick wit, his intellect and his innovation were incredible, and his generosity of spirits drew everybody to him, and everybody enjoyed being around him. He was quick to a joke. He was quick in self-deprecating humor, and very, very supportive of his friends. As a professional, he was an outstanding contributor to our community. First of all, he was provided outstanding care to his patients, and was always, and that was always at the top of his priority list. But beyond that, he went on to organize trauma services at Henry Ford Hospital and at Detroit Receiving Hospital that became models for the rest of the country. He ensured the quality of care, just not for his own patients, but for all the trauma patients that presented to those institutions. And then ultimately, as chair at St. Louis University, he again focused on quality and improving the care of all patients. At the same time, at all those institutions, he was a mentor to hundreds of residents and fellows who all remember him fondly as a fantastic mentor, but a mentor who definitely required that everybody meet his standards when they were under his direction of high quality and real dedication to orthopedics. He was an outstanding researcher and contributed some of the most important papers to the orthopedic literature, especially in the area of pelvic and acetabular surgery. We were fortunate to have him as a colleague because as he moved much of this research forward, he included us in collaborative studies. And he was a great organizer of these collaborative studies, mainly because he was a taskmaster. And even as a very personal friend, if you missed a deadline, you could count on Roy calling you and harassing you until you got your portion of whatever was necessary in as a contribution. He will be greatly missed in our community. He was a great friend, a great contributor, a great mentor, and truly a great pillar to our orthopedic profession. He's much deserving of this honor, and again, I'd like to thank all my colleagues who helped make this possible through their contributions.